Welcome to this lesson on changing lifestyle habits that lead to dementia. In the last lesson, I showed you that certain genes you inherit from your parents can increase your risk for developing dementia, but don't guarantee that you'll end up with this condition. How you live your life, the lifestyle choices you make, the environment you live in can switch genes off to stop you ever developing dementia. In this lesson, you're going to discover and learn about the other risk factors that dramatically increase your chances of developing dementia, how you can avoid them or minimise their impact on your brain health to protect yourself against dementia. This lesson includes the most up-to-date research on the choices you make every day and how they affect your risk of developing dementia. So age is the biggest risk factor for dementia, but only for the reason that as you get older, the more likely you will have experienced the damaging effects of inflammation, oxidative stress, blood sugar abnormalities, and damage to the brain's raw materials that, as we've discussed, are the root causes of dementia. Each decade of your life has the potential to cause significant stress and predispose you to developing dementia later on in life. So in early childhood, if you've been unfortunate enough to experience physical and emotional trauma or neglect, this will cause damage to your brain later in life, reducing the number of brain pathways which makes your brain less resilient to the stress it experiences later in life. In your 20s and 30s, you might experience educational and professional stress, live off unhealthy foods, and perhaps skip both the exercise and sleep that your brain needs, setting the stage for declining brain health in midlife. As you progress through your 30s and 40s, you might see the first signs of chronic disease, high blood pressure, high cholesterol, diabetes, all of which adversely affect the brain and are high risk factors for dementia. And later on in your 50s and 60s, cumulative blood vessel disease might start to emerge in the form of cholesterol buildup, blood vessel damage, and mini strokes that are so small they don't get picked up on brain scans. And your brain's waste disposal system can also get overwhelmed with byproducts and toxins that cause dementia. So by the time you reach your 60s and 70s, the hallmark signs of dementia might begin to show up on brain scans and other laboratory tests. The brain shrinkage, the loss of brain connections, and the build-up of toxic proteins, particularly in the parts of the brain that deal with your memory, thinking, and sensory awareness. So this is when you finally might begin to experience the symptoms, the debilitating psychological and cognitive effects of dementia: impaired memory, especially short-term memory, impaired executive function, your ability to form complex tasks, and an impaired visuospatial sense, and that's your ability to quickly and accurately interpret what you see. As you enter your 80s, the more likely you are to experience dementia symptoms. So the longer you live, the greater your risk. So how do you go about avoiding or reversing decade on decade damage to your brain that accumulates into dementia later in life? Well, there is a way forward to avoid dementia. Research points unequivocally towards lifestyle intervention as the cure for cognitive decline. The way you live your life, your day-to-day life, is scientifically proven to prevent dementia. And I'm going to show you how by giving you 5 lifestyle tools that prevent dementia in your dementia prevention toolbox in module 3. So women are also at a much higher risk of developing dementia than men. For every man suffering with Alzheimer's, there are sadly 2 women living with this disease. And in the next lesson, I'm going to unpack exactly why women are at higher risk of dementia and how they can reduce their risk by adopting a brain healthy lifestyle and managing the impact of hormonal changes on their brain at the 3 key stages of a woman's reproductive life. So there are actually 12 lifestyle factors which, if modified with the right lifestyle intervention, can reduce your risk of dementia by up to 40%. And that's according to research done by the Lancet Commission in 2020. So less education early in life has been shown to be detrimental for your cognitive performance later in life. And there are different explanations for this finding, but regardless of the reasons why, you can compensate for less education earlier in life by engaging in scientifically backed learning and social activities later in life that challenge your brain. So these are not the often touted brain games, crosswords and puzzles that are claimed to improve your brain function. I'm going to give you enjoyable activities that challenge different parts of your brain in the Dementia Prevention Toolbox in Module 3. Uncorrected hearing loss increases your risk of dementia. So make sure you use hearing aids for any hearing loss to reduce hearing loss, because this actually protects your brain from the really damaging effects of loud noise levels. Why this matters is because damage to your auditory brain, so that's the parts of your brain that process sound information, will often also cause incidental damage to the memory centers of the brain. The reasons are that these parts of the brain are adjacent and connected to each other. So without a hearing aid to control the noise levels coming into your ear and then into your brain, loud noise damages your auditory brain, which in turn damages the memory centers, and that's the part most often compromised by dementia. So cumulative damage to your blood vessels from years of high blood pressure also increases your chances of stroke and heart attack, both of which cause brain damage and dementia. Try to maintain your blood pressure below 120/80 to prevent damage to your blood vessels. That's a systolic blood pressure below 120 and a diastolic blood pressure below 80. Blood pressure management often becomes necessary from about the age of 40 onwards and can be achieved with the right lifestyle, diet and medication. Obesity and the linked condition of diabetes actually double your risk of dementia. Type 2 diabetes is such a big risk factor for dementia that some scientists have labelled Alzheimer's disease as type 3 diabetes. In lesson 4 of this module, I break down why diabetes starves the brain of the energy it needs to survive and how to prevent diabetes to prevent dementia. Excessive alcohol consumption over a lengthy time period shrinks your brain. People who drink heavily over a long period of time are more likely to have a smaller brain and less of the brain's white matter, which helps to transmit signals between different brain regions, and this can lead to memory loss and dementia. So you should try to reduce your alcohol consumption as much as you possibly can, particularly in midlife, to minimise the risk of developing mental decline and memory loss. Try to limit your alcohol intake to no more than 14 units per week, or no more than about 1 alcoholic drink per day. Traumatic brain injuries also increase your risk of dementia. Traumatic brain injury is a change to the brain caused by an external force, which can happen for a variety of reasons, including traffic accidents, assaults, falls, contact sports like football and rugby, and many others. So concussion is considered a mild traumatic brain injury, but falls are the most common cause of traumatic brain injury. So to reduce the risk of falls, you could use a walker or other assisted device to compensate for mobility problems, muscle weakness or poor balance. Have your vision checked regularly and use glasses or contact lenses that correct for changes and avoid household hazards such as clutter, loose rugs or poor lighting. You can also take steps to prevent injury to your head by avoiding or reducing time participating in high-risk occupations and sports which have a big risk of head contact and traumatic brain injury. There's also evidence that smoking, as includes exposure to secondhand smoke as well, increases your risk of dementia. Not everyone who smokes will get dementia, but stopping smoking is thought to reduce your risk back down to the levels of someone who doesn't smoke. And air pollution has also been shown to increase your risk of dementia. And I'm going to unpack how to avoid the pollutants and toxins in the environment that surrounds you and that increase your risk of dementia in lesson 5 of this module. Depression is more common in people with dementia, particularly if they have vascular dementia. And depression is often diagnosed when a person is in the early stages of dementia. However, it can actually develop at any stage, and people with more symptoms of depression tend to suffer a more rapid decline in thinking and memory skills. So if you suffer with chronic depression or have the beginnings of dementia and feel depressed, it's really important to treat the depression and try and treat it as aggressively as you possibly can. And the treatment for depression at any age will typically involve a combination of antidepressant medicines, talking therapy and cognitive behavioural therapy, which will teach you the skills you need to cope with your depression. And if you lead a socially isolated and sedentary life, this also increases your risk of developing dementia. In your Dementia Prevention Toolbox in Module 3, I'll explain the reasons why and give you 2 dementia prevention tools to help you socialise and exercise in a brain healthy way. So the key takeaways from this lesson are there are many risk factors that increase your chances of developing dementia, but nearly all of them in fact, can be avoided or mitigated by making the right lifestyle choices. So age is the biggest risk factor. That's only because as you get older, you are more likely to have accumulated the brain damage caused by those root causes of dementia. Women, sadly, are twice as likely as men to develop dementia, but they can manage this risk by adopting key lifestyle habits and hormonal management strategies that we're going to unpack in the next lesson. And there are 12 lifestyle factors: less education early in life, uncorrected hearing loss, high blood pressure, obesity, diabetes, excessive alcohol consumption, traumatic brain injury, smoking, air pollution, depression, social isolation, and leading a sedentary life, which if modified with the right lifestyle intervention can reduce your risk of dementia by up to 40%. So I look forward to seeing you in the next lesson, where I will address how women can reduce their heightened risk of dementia.